Hi, this is Dr. Durham with the first installment of Setting Denture Teeth videos. In this one, we'll just set the maxillary arch. When you're looking at this cast, this is the cast we have coming back from the Ideal Bites. You notice it's a little bit crooked. See these lines? They show there's a little bit of a cant. I mean that the top member of the cast and the bottom member of the cast were cut not really parallel to the zenith or perpendicular to the midline. Now I've gone ahead and trimmed them on the grinder so that they would be parallel to the zenith line and perpendicular to the midline. But notice those points where the frenum emerge, they're still a little bit off-centered. I'm going to go ahead and draw some midlines on the cast as well as sharpen those points so that it orients my eye and calibrates me right to those wax rims. So I'm forced to make sure that everything is precisely in place. At this point, I'm now ready to go ahead and mount this on an articulator. I could use a fully adjustable articulator, a semi-adjustable articulator, or a hinge articulator. The hinge is the least sophisticated, but in this denture setup will make it a lot easier for us to go ahead and look at the anterior teeth as I'm setting them. Okay, so with this hinge articulator, what I'm going to do is I'm going to mount it so that we still maintain a lot of the external references. Notice how the back members are parallel to the zenith line, and it's centered very well over the articulator. Now we're ready to go ahead and make diatorics to set teeth. Diatorics are just holes in teeth that allow acrylic to flow during the processing so that it locks them in mechanically. You can imagine if that acrylic went up into those little holes and then gelled and turned hard, it would hold it into place a lot better than if it was just a chemical bond. So let's move forward now. Go ahead and set our first tooth. We're going to keep the first tooth parallel with the occlusal plane. In fact, all the teeth we will set will follow the occlusal plane, but here we've tipped a little bit mesial and we're right up against the midline. A nice look for that first central tooth. Let's go ahead and set the same tooth and look at it from the side. Now it's perpendicular to the occlusal plane, creating a 90-degree angle to the occlusal plane that we created in the mouth. Then we'll go ahead and look at it from an occlusal view. With the eye looking straight down the facial surface, that's going to orient us for the remainder of the teeth. And you'll see what I mean in just a second. But right now that's just registering or orienting our brain to where the other teeth are going to tip. Okay. Next, we'll set the lateral incisor. The lateral incisor sits about a 1/2 millimeter apical to the central's incisal edge. Okay. From the side view, it's a little bit of a smaller tooth. It sits back with a smaller root, a little bit more lingual than the central incisor. From the occlusal view, you'll see what I mean. Looking straight down the facial of the central, we can see that the lateral is tipping more lingual. Okay. Next, we're going to set the canine. The canine is the first tooth that curves both from the anterior to the posterior, curves those two planes and joins them. And that's a nice look. It sits a little bit higher than the central, but not as high as the lateral, and it kind of follows the curvature of that wax rim. From the side view, it tips a little mesial. You can see that. Big prominent root. It's going to sit a little bit forward, and then it's going to tip a little bit more than the central and the lateral incisor towards the lingual. Now we'll set the first premolar. Notice how the facial contour of the premolar follows a very similar plane as the canine. We're going to use that to our advantage to use perceptual disappearing teeth, and you'll see on the second premolar that we set what I mean by that. This one is also tipping a little bit mesial from this view. Still right in line. All of our teeth are still pretty well in line with the occlusal wax rim, parallel to. This is us following, the supporting cusp is following the maxillary ridge. Next tooth. See how the facial plane is again following the same profile as the second and the canine, first premolar and the canine. Okay, can't really see the neck of that. Sorry, it's covered in wax. But the idea is it's still tipping mesial, and we're still following the same parallel plane from the wax rim. Supporting cusp right over the ridge of the maxillary arch. Okay, let's go ahead and set some molars. Also, their profile from the side is very similar to the canines, to the first premolar, second premolar, giving us a nice disappearing harmony and perspective. Okay, all the teeth now in a plane, 11-degree pitch, and perpendicular to the central incisor. That's all the supporting cusps sitting over the height of the maxillary arch ridge. With all those teeth set in place, we can set the central incisor. The central incisor I'm going to set here just so you can get this one set in place, and then go ahead and set the remainder of the arch. But notice how well it follows the constructed lines we created on the cast. That's it for the first section of setting denture teeth.